I just wrote the speech. I don't know. Hopefully we'll try to rush through it, 10, 12, 13 minutes. All right, my name's Jennifer McCreath, and does everyone know who I am? Is anyone who's not familiar with me and never heard of me before today? Okay, I'm just curious to know if people actually do know who I am. Who's in the room? Is everyone here a student? Anyone not a student? Healthcare? Anyone here? Any health professionals in the room? I'd like to know who I'm talking to, but okay. Okay, a little bit of terminology, words I'm going to use tonight that you may not be familiar with. Cis, C-I-S person, basically means you're not a trans person. And in our world, trans is normal, cis is not. So you're going to hear the word cis probably. Transgender means to desire and or require to live life in the opposite gender role from which that was assigned at birth. Transsexual means, in addition to any gender issues, desire or requirement to have sex reassignment surgery. And that's the bulk of my discussion tonight, as it is a health discrimination topic, is specific to sex reassignment surgery and the issues around that. For the record, I am a transsexual person. I'm also a lesbian woman, which is kind of an afterthought, interestingly enough. Usually it's a major issue for people who are coming to terms with their own sexuality, but people, I think, are so fascinated with transsexualism that they don't even get to the question of, well, who do you like to sleep with? Okay, when I started my transition, which was about 3 years ago, I started this, it became evident I could not do this alone. I needed help from medical professionals who would offer advice and act as, a word they hate, gatekeeper. Transition team usually requires a family doctor, a psychiatrist, psychologist, and first I had a bit of a hard time getting people willing to work with me. Doctors, one by one, I made a list of, okay, I've moved to Newfoundland, I need a family doctor. Let's go through the list and see if we can find someone who's comfortable working with me. And I had some resistance, usually because they were not familiar with the issues that were on my plate and didn't feel they were capable of providing me the care that I needed. Luckily, I didn't really come across any, I guess, phobic, negative. No one told me it's not a religious thing. I can't help you because of that. So, as we heard through Susan's speech, there are, I guess, doctors out there that do cite that issue. Many said that, well, there's no formal document, there's no protocol, there's no policy, there's nothing that our Department of Health here has in our province, there's nothing in Eastern Health that says this is how we treat trans people. And because of that, they felt reluctant to accept the documents that I brought to them. Said, well, here's what they do in other parts of the world. There's a protocol known as the Harry Benjamin Standards of Care. It's generally regarded as the book on how to provide care for trans people. It's been recognized in many jurisdictions all over the world. And finally, I was able to convince the right people to take a look at this, and they felt comfortable applying the protocol. There are theories that try to prove that transsexualism is an intersex condition that occurs during the first 3 months of a pregnancy, but we've yet to formally identify a guaranteed proof. It would be great if you could just blood test everyone when they're born to prove whether or not they're trans. We're not there yet. So the psychiatric and psychological assessment process is the best way to help the individual and the professionals reach, I guess, an understanding of exactly what type of care is required from the individual. So this Harry Benjamin protocol states that one should undergo 3 months of psychotherapy or 3 months of what's known as a real-life experience test, living your life in your new desired gender role to basically prove that you are trans and that you're ready to pursue, I guess, the medical side of things. It worked out great. I met with a psychiatrist here in St. John's, a psychologist here in St. John's, as well as an additional psychologist outside of the province, and spoke with my family doctor as well. And 3 months, we all kind of reached, yep, this really is for real. Yeah, Jennifer, yes, you really are a trans person, and taking steps here to deal with this is right. So the first step is medically, hormone replacement therapy. You want to feminize the masculine body through hormone changes. Okay. Again, there's no formal document anywhere in this province that says this is how we do hormones in Newfoundland for trans people. So there's a document in Vancouver that I guess has been utilized in other parts of Canada, obviously in Vancouver, but also in other provinces. And my family doctor looked at this and said, yeah, I think I can handle this, I can do this. I'd like to get in touch with Vancouver and talk to them. And so that worked. We proceeded, and basically I got to go ahead to start the hormone therapy process. Before I did that, though, the thought of, well, what if you won't have children later in life? Within a month of taking estrogen, your testicles aren't going to work, basically. So I looked into the possibility of sperm storage. Put them in a test tube in a freezer and save them for a rainy day. Lots of rainy days here, obviously, in Newfoundland. But apparently, if you have to have your testicles removed due to cancer here in St. John's or in Newfoundland, MCP, the Department of Health, would be glad to store your sperm for you here in St. John's free of charge. But if you need your testicles removed for other reasons, such as gender dysphoria, sorry, we don't do that here. You're going to have to deal with that on your own, Jennifer. So I whipped up my credit card, which luckily for me, there's a big credit limit there. And, flew away from Newfoundland and found myself a nice little private clinic. Spent some money to do that. What else do we need to do here?